of the Adult Social Care and Public Health Committee held on the 26th of July. Can I just ask the committee if those minutes can be agreed? In favour? Thank you. Do we have any apologies for absence? I know we do have one at least.
Yeah, we just have Councillor Lee who's substituting today for Councillor Turner.
Okay, thank you, John A. Cheers. Declarations of interest by members and officers. Do any members or officers present have any disclosable pecuniary interests due to declare? And do any members or officers present have any private interests, either pecuniary or non-pecuniary, to declare? If any come to you later on in the meeting, you can always raise your hand then, okay? But do we have any? Okay. That takes us to the first substantive item on the agenda, and it's the Nottinghamshire Day Opportunity Strategy for 2021 to 2026, agenda item 4. Following engagement activity with people who use services, their families and carers, service providers and staff, Adult Social Care and Health has produced a draft day opportunity strategy. The day opportunity strategy aims to shift the current reliance on traditional building-based day services by developing a range of community offers that are flexible, person-centred and are rooted in local communities. Future model of day opportunities will be based on prevention, early intervention, re-ablement and enablement offer, which will ensure people with learning disability can live more inclusive and independent lives who often face barriers and discrimination in society. The report provides an overview of the strategy and the work to date, as well as outlining the next steps required, including approval for public consultation. I'll move the recommendations as set out on page 7 of the report. Do I have a seconder?
I will second those, Chairman, and reserve the right to speak.
Thank you very much, Councillor Carlton. And I'll hand over to Ainsley. Thank you.
Thank you, Chair. So the draft day opportunity strategy sets out the vision for how we would like to support people to live fulfilled lives in their local communities. People with care and support needs can often face particular barriers in accessing mainstream activities and services within their local communities, and the strategy considers how people can best be supported to achieve the outcomes that they want. The COVID-19 pandemic did push us to provide day opportunities in a range of different ways. For example, outreach services into people's homes, more personal assistance support, and more online activities and connections. These new ways of working have proved to be quite successful and is something that we would like to retain and build on as part of the strategy development. Another positive outcome of the pandemic was the response of local communities in supporting vulnerable people within their midst. And again, this is something that we can build on through strong partnerships with the voluntary and community sector. Our current service arrangements are very much valued by the people who use them, and the aim of the strategy isn't to replace one thing with another, but rather to support access to a wide range of services and activities, which includes both specialist and mainstream services, access to further education and employment support, and focuses on developing an inclusive society where the people we support are able to access ordinary community activities either with or without additional support. This is likely to be quite a gradual shift as people are supported to try new things, and existing services will need to flex and adapt in response to this. This includes our internal day services, whose strength really lies in being able to support people with the most complex needs, and we would like to further develop this to provide specialist day support to people with, a range of complex needs, including dementia and autism. The draft strategy, as you've heard, has been developed with some initial engagement with people who use our services and their carers. There's also been engagement with internal staff and unions, and recent feedback from Unison has been quite positive in that they recognise that services need to evolve for the sort of, access to wider community and provide a more personal approach, but they wanted it to go on record that they would like to see some buildings-based provision retained. So the next step in further developing and progressing the strategy is to go out to formal public consultation, which is the ask of committee today. Thank you. I'm happy to take any further questions.
Thank you, Ainsley. I will open it up, but just remember that we are asking to go out to the public for consultation. We're not agreeing that at the moment. Okay, so we're waiting for that feedback to come back. So any questions?
Yeah, thanks, Chair, for bringing me in. In relation to the public consultation, can you highlight to the committee how you intend to make that consultation wholly inclusive and not just a paper exercise, making sure that I know some of the service users have actually been spoken to and the views sought already, but I think it's vitally important that we do drill down to get a totally inclusive response to our consultation, and it isn't just a paper exercise. In relation to the view that services now are predominantly building based, could you highlight what you're thinking about doing in the future in relation to, because the officer mentioned retention of some building based services, or are you wanting to wait for the consultation? Our group is willing or will support the recommendation to go out to consultation, but we're just wondering for the future, do you as chair of this committee see a role for the county council in provision of services, and where do you think the modern thinking about inclusiveness, working in the community, will lead us into what direction? Would it also be possible, Chair, for you to, I know there's indications in the reports of number of service users in various locations. Would it be possible for you to draw up a map for us highlighting where all these services are in Nottinghamshire for us, so we can actually see where they are? Thanks, Chair.
Thank you for the question. With regards, it won't be a paper exercise. We're going to be collaborative with districts. We're doing outreach work. It's one of the positives that has come from the COVID. A lot of community groups have expressed an interest, and we'll be working with them. But regards a map and how we're going to do our building, I'll hand back to Ainsley. I know Cash is nodding as well, so. Okay.
Okay, so just in response to your questions, Councillor Henshaw, in terms of inclusive consultation, yes, it absolutely will be. We apply a methodology called co-production in adult social care, which is very much focused on talking to the people who matter and doing that in a way that suits them. So we already have existing groups and existing mechanisms to talk to people, certainly people who already use services, but it's also important to hear the views of people who might use our services in the future. In the same way that we did as part of the engagement exercise, we will talk to those existing groups, but we also want to hear wider than that, and we will ensure that, you know, it's not just a paper exercise. We've developed the draft strategy on the basis of what we've heard so far, but we want to hear more from people. In terms of the future of building-based services, to some degree, that's a bit of an unknown, because that will depend on what people say and how people's patterns of use develop and change over time. But it will be quite a gradual shift, I suspect, as people experience, new things in their communities. They may well move away from some of the things that they do now. And with regards to our internal day services, they absolutely have a role. I mean, those services sit within my directorate, so I've got a particular vested interest. And the role that I see is along the more specialist route, because that's what we do extremely well. And those types of services can be quite difficult to get in the external market. So I very much see the role of the in-house service as supporting those with the highest needs. And our buildings, the majority of our buildings are set up to support those needs. And then in terms of map of services, yes, myself and Cash can work on that to provide you with that.
Thank you, Ainsley. Does that answer your question? I think it's a good question. I think it. Councillor Martin, you've indicated a question.
Yeah, thank you, Chair. As your report states in paragraph 7, 1,500 people, some of the most vulnerable people across the county, accessing these services. Obviously, some of those will be reticent to come back, and the Office for National Statistics says that people are less likely to want to come to building-based services provided by the county. So are we doing anything to help break down those barriers? And would we considering that it looks like we're going to have to live with COVID for longer than we all anticipated in one form or another, do you think it would be good to ask if we would consider using some kind of passport system? Because obviously some of the people who've got the or higher risk have not had the vaccines.
So we are, people have been coming back in incrementally over the past few months. Some people are really keen to come back. Others are really quite anxious about coming back for the reasons that you stated. We are supporting people in really a range of different ways. So that's one of the reasons why we're keen to carry on some of the outreach activity that we've done through the pandemic, so that people don't feel that they have to come into a building to receive a service. We still apply a lot of elements of social distancing and all of the sort of infection control measures, and that will continue for as long as that needs to continue. And some of it is negotiation with the individual and their families, that perhaps they may have come for 3 days previously, but actually they only feel comfortable with coming back for 1 day and doing something slightly different on the other day. So we are working with people on an individual basis to get them engaged in something, but that may not be what they did before, because we are having to respond to people's fears and anxieties. In terms of a passport, I think that could be quite tricky, because we have got service users who may have sort of medical exemption reasons why they can't have the vaccine, and I certainly wouldn't want to get into a situation where people are sort of known to have either had the vaccine, not had the vaccine, and some of the issues that could create with bringing people together. But we are risk assessing everything that we do within the day services, to try and give both people that use the services, their families, but also our own staff, reassurance that we're doing as much as we can.
Thank you. Can I just add to that? After a visit to the MASH last week and talking with staff and officers there, it was a very good question you just raised, actually, because loneliness from COVID the issue, is a great issue, and it leads to anxiety. A lot of people have got used to being in their houses now for over a year and not mixing with other people, and of course it's going to be difficult to get them out. And as Ainsley has alluded to, then it's negotiating with them, it's outreach work, it's getting them back into their communities, and that's what we're going to be doing. We're going to be working with them. So, but yeah, good question. Thank you. Councillor Welsh. Thank you.
Thank you, and thank you for this report. As Councillor Henshaw has stated, we'd be quite willing to support the report as it stands at the moment. The future of day opportunities, I think, is at a critical point for many reasons as we enter what some people would call a post-pandemic era, and I'm not utterly convinced of that. Services will need to change. If this consultation is truly about putting people at the heart of services, if it's truly about the modernisation of day services so people get the absolute best and are able to integrate with their community and have the opportunities that you talk about, then of course we welcome this consultation, because as I said, it's at a critical point. There's a couple of things I do want to pick up on. Ainsley, you did mention about improving access to employment. We've seen reports in here, our performance with regard to that is actually pitiful. So if there are any changes to services, what is that going to be and what is that going to look like? And the other critical thing is with what Councillor Boyd-Elliott just said with regards to isolation. There's a lot of people that have previously accessed day services on a regular basis and stopped during lockdown, and this has had a profound effect on them and knocked them quite back. What I would hate to see is any changes to services that saw a decrease in services across Nottinghamshire. What needs to happen at the moment is an increase of services, not a reduction. There are more people that are going to need day services. There's national research which backs that there's more people that are going to need opportunities for day service and support. And as I said, it is about reducing that risk of isolation and making sure these people are really integrated within our community. The other aspect that I did want to raise with you with regards to the fact that the NHS has some day services for high need. They're already under a considerable amount of pressure, and they envisage actually that pressure will increase. So any changes that you envisage making after the consultation, I'm assuming will take this into account, because what we would hate to make is decisions here at the County Council that then has a further impact down the line elsewhere. As I said, we firmly believe in the modernisation of day opportunities for people in Nottinghamshire if it has them at the heart of it, and it isn't an exercise to do anything else.
Okay, so in response to your points, Councillor Welsh, in terms of access to employment, yes, I would agree our performance to date has not been good. That is an area that we continue to work on, and I think perhaps with the state of the job market at the moment, there are so many vacancies. I'm hoping that actually gives us more opportunity to place people. In addition to that, we have, pre-pandemic, things kind of paused during the past year, but we did actually launch a corporate programme of work across adult social care, children's services, place, etc., to look at how we can expand on employment opportunities for people with disabilities and mental health issues. And we've got, a range of partnerships with other organisations, because this isn't about us doing all of it ourselves. It's about how we actually engage with other organisations to get people into the workplace and break down some of those barriers. And I'm hoping that, given, as I say, the amount of job vacancies that there are out there and the workforce pressures, that will actually give us a bit of an in to try and place more people in the workplace. With regards to your comments about people previously attending day services. Certainly the people who have attended our in-house day services, we've kept in contact with them throughout. Now that's either been home visits through the outreach service that we set up, or online contact through Teams or telephone, or whatever mechanism has been best for them. And as I said to Councillor Martin earlier, we are trying to encourage people back in, but it's, you know, it's a difficult one because, you know, you can't rush people when they're so anxious. But certainly I would like to reassure you that we have kept in regular contact and tried to include and engage them in activities throughout. And I think certainly, as I said in my narrative, I think the role of local communities and how they've supported people is something that we certainly don't want to lose, because I think a lot of local communities have been absolutely fantastic in getting to know those more vulnerable people in their communities that possibly they didn't have a relationship with previously. So we do want to retain that. And I think it's going forward, you know, I can see it as being a bit of a hybrid between, you know, the sort of statutory services and the role of the community and voluntary sector in a way that maybe we haven't really expanded on before. And then absolutely take your comment about NHS day services. I mean, it's one of the reasons why I think our in-house provision should focus on the more specialist end. And I think the NHS would have an interest potentially in bringing people into our more specialist services.
Cash, do you want to add to that?
Just to add a couple of points really in it from Mainsley really, and I think in terms of this is a really ambitious draft strategy. It really much talks about how we ensure services are future proof or fit for purpose based on our needs of our population. And actually, when you look at the draft strategy, it's very much underpinned by the initial engagement from people with lived experience. And again, the actual day opportunities draft strategy proposes a tiered approach, a much more comprehensive option, flexible option for people to access day opportunities, and that could be through our internal day services that have played an incredible role during the pandemic, and ensuring that support people with the most vulnerable have been supported throughout this period, but also what I want to just highlight is that a tiered approach around early intervention. Also, there's evidence that we can support people in more independent settings. We can actually support more people in universal and community-based services. So very much around that inclusion, community participation. What's going to be really key here is our relationship and our joint commissioning approach with the NHS. So I'll take your point on working in collaboration with the NHS, and I think the relationships are really positive, and we've built some really good relationships throughout the pandemic with NHS, so we want to build on that. And there is a really good forum where we have those strategic conversations, the Learning Disability and Autism Executive, which is chaired by Melanie, and I think those are where we can have those conversations with NHS on that front. So I just want to highlight some of those key points.
Thank you. Councillor Carr.
Thank you, Chair. I'm not going to make any criticism of this because I can see that it's been done in the best intentions. Let's not forget how quickly the pandemic happened. The week before we went into total lockdown, there were 250,000 people at the Cheltenham races. That's how quickly it happened. And all councils got things right, some things right, and all councils got something wrong. So it's no good pointing fingers, but there's one area where I think that we need to learn a lesson, and I really do hope that this consultation addresses that. And that was elderly or getting on a bit parents who had children in their 30s, many of them, with learning difficulties, who suddenly went to having the daycare services that their children went to, which gave them respite because they're getting on as well themselves. All of a sudden went from having that to having their children 24/7. And I had a couple of families in my division who were at their wits' end, to say the least, and didn't receive a lot of help. And as I say, I'm not criticising everybody because this was a very, very new situation to us. And they were phoning me and saying, when can we go back? When can we go back? And I'm saying, well, I honestly don't know at the moment. We don't know at the moment. And I think that if this, for me, if this consultation future-proofs that how we respond to that, should we, heaven forbid, be in this situation again, then that will be a good outcome from my point of view.
Thank you, Councillor Carr. I've got Councillor Doddy next.
Yes, thanks very much, Chair. I have to say, when I read it, I had pretty well the same sense of hope and excitement as Kashif had when he read it, having been involved over the last number of months in developing the ICS, which is basically linking up social care, the NHS and the voluntary organisations. The world has changed, and bricks and mortar, etc., don't necessarily fit the needs, as Councillor Carr's pointed out, of everybody, and particularly hasn't got the flexibility to deal with crises, particularly when they arrive. But I see this as sort of development of sort of a new world. And it overlaps with my day job in that as a GP, we have such a thing as a social prescriber in every surgery. And yesterday I was speaking to the social prescriber because I had a woman who was sitting at home in tears because she was so lonely, and she says, you can't understand how lonely I am. And I went straight back and I went into her and had a chat with her. And she was talking about putting them in contact with the befriending services, etc. And then we were chatting to the Borough Council and Alex McLeish, who runs the health role for the borough. And you were starting to see something that resembled the plan of the Integrated Care Service, which was a circle of care, which involved social care, which involved the NHS, which involved all the partnership organisations, which involved the voluntary organisations. And you were starting to see the potential for something beautiful emerging from it. And these are the opportunities that will be continuously presented with post-COVID. So I share the lovely linking up of services that this could potentially lead to, whereas social care on its own cannot cope for every demand and every need, for the flexibility required for different people and how they want to access things. And if that's digitally, that's great. But if it's full care in daycare, that's great too. But it's something that we're all doing, and this is the first time I've actually seen it being linked up and seen the real hope for the future with regard to providing that ICS model, linked up care of all the organisations, from social care through to primary care networks, through surgeries, through to voluntary organisations, and I'm really excited about it, Ainsley. Thank you.
Thank you, Councillor Doddy. Councillor Fielding.
I don't know if it's always wise to follow Councillor Doddy, who's always so eloquent, but I concur with what my colleagues and Councillor Carr has said. We need to move forward. We want quality daycare provision, and it needs to be sustainable into the future. And it's how we work with voluntary and community to ensure what it is available is of quality and sustainable. And I think it's ensuring it's sustainable.
Exactly that.
Is extraordinarily important.
Thank you. I'll take one more, and it's Councillor Kerry, and then
Thank you, Mr. Chairman.
Okay.
Look, welcome this report. I think anything that goes to try and improve, enhance, understand the needs of our service users, and to give them choice in terms of how they want those services delivered is a very positive thing, and actually taking on board the comments made by members about our reaction to COVID as communities. And this council did a wonderful job, in my view. This must be seen as positive. I have a similar experience at Broxtowe Housing when I was chairman. We looked to change retirement living from a prescribed service, daily visits from service officers, to an almost customised service to the needs of our tenants, and the work done to understand those needs, to understand what they wanted in their service delivery is really interesting. It helped to improve their lives, and I can see that housing is going to be part of this. So I hope that work will also continue with the housing. But very positive. Really happy to see this. Thank you.
Thank you. It's had a good debate on that. I think it shows the day opportunities. We need the positives from our local communities, the needs of our population. That is, we need to meet those needs, something that's fit for purpose. And I think Councillor Carey's just used the right word, and we can enhance that with our local communities working collaboratively with us. So, thank you. We'll now move to the vote for the recommendation set out in the report. I'll just take the vote by a show of hands. So, all in favour, please. That's unanimous. Thank you. Okay. Agenda item 5. It's an update on the adults and health recovery from COVID. As we continue to respond to the pandemic, we have reviewed and updated our recovery plan and priorities, and these are presented here for the committee to consider and approve. There have been significant challenges faced during wave 2 of the pandemic, not least dealing with the impact on a fragile social care market. The Quality and Market Management team has managed and supported up to 286 outbreaks in total across care homes, and now has a backlog of adults audits across care homes. So the report includes a request for increased resource to help the team transition safely to recovery and meet the business as usual demands. This proposal will support the department to meet its legal duty under the Care Act 2014, which requires the council to ensure there is sufficient supply and sustainable care market for its residents. This report also highlights learning and feedback on new initiatives introduced during Wave 2, as well as exciting investment plans in technology-enabled care to support people's independence through innovative and low-cost solutions. I move the recommendations as set out on page 12 of the report. Do you have a seconder?
I'll second those, Chairman, and reserve the right to speak.
Okay, thank you. And I hand over to Melanie, who's joining us remotely. Can you hear that? You all right?
I can.
Can everyone hear? Everyone hear Melanie?
Morning committee. So if you recall, in July we brought quite a significant report to you, and you approved us changing some of our priorities and investment within our budget using our underspends to focus on areas of significant pressure. Since July, some of those areas of pressure have escalated quite significantly, and we cover some of those in the report. So we're now seeing some increases again in outbreaks in care homes, and you'll hear about that in agenda item 11 when we talk about the state and the quality of the market. Public health, we have had additional grant opportunity through the Contain Outbreak Management Fund, but we still lack some internal capacity to respond to that. And we've seen significant operational pressures in our teams. We've started to divert some of that resource. We are seeing some recruitment taking place, so we are starting to see some of the impact of that, particularly stabilising the MASH, which is good news. Throughout the pandemic, we have tried to continue with some of our programmes of work, particularly those that are helping us adjust our service models in the way you've just heard from Ainsley's presentation initially. So we are continuing with the device lending scheme and considering how we use digital technology to enable people to access our support information, advice, and be independent where possible. Our culture change programme, I think, is absolutely crucial. So I was really pleased to hear of the support for our co-production approach and putting the person centre. So we've been working on that in 2 ways as a department, and through the strength-based approaches in the innovation sites, which you can read about in paragraph 33 and 34, and through our owning and driving performance, which is our culture change programme for staff. So we're very committed to this this culture change programme. Unfortunately, a number of our other areas of strategic development have stalled or been suspended temporarily whilst we're dealing with the service pressure. And in July, you gave some additional resources for us to be able to employ project management support where possible to try and focus on those areas. We indicated a number of themes that we needed to work up in a bit more detail before we were clear about what capacity we needed. So in this report, in paragraphs 43 to 47 and 49 to 52, we're just bringing back those two areas. So essentially, the main area was technology enabled care. So if you recall, we had an independent assessment by PA Consulting to look at how we were using technology enabled care to the best, how we could maximise this through the pandemic. So we've had that report back, and we were requiring some additional investment in staff capacity to implement those recommendations in the report. So that's in paragraph 48. And I think the other area of investment is in the quality market management team. So committee have recognised consistently through the pandemic the pressure that we've had within our commissioning team to respond to support the care market and the pressures we're seeing there. We're dealing with COVID. So we're wanting to invest in some additional capacity in the contracts team, quality team, to continue to support that to the high standards we've seen in the last 18 months. So the recommendations are that we would like to use our departmental underspends in a different way, employ the resources which are summarised in table 59. I won't go back over the service pressures. We've got a performance report coming next. We'll reiterate some of that. But that was all I wanted to recommend. Thank you, Chair.
Thank you very much, Melanie. I now open it up. Do you have any questions? Councillor Carr.
Very good to see that we're doing these sorts of things, but of course the council does have a public health duty given to it by the government. How does that pan out with the fact that I actually feel quite safe in this room at the moment, although it could do with a bit more ventilation? I only noticed there's one window open. But on Thursday, we're going to be expected to sit in this room with up to 80 other people, some of whom won't be wearing masks, despite the fact that the government guidance is that you should be wearing a mask in that sort of environment. How do we equate that with our public health duty and the recovery from COVID?
Would you like me to comment, Councillor Elliott?
No, it's...
Yes, please.
Sorry, I can't hear if the microphone is being used. Councillor Carr, so the council has always been committed. It's been one of our overriding principles for the leadership team to follow the current guidance and good practice that's set down for us in our COVID security. Certainly it isn't within the scope of the public health team to be agreeing how political meetings are conducted, but my understanding is that the facilities team work to the guidance around risk assessment. But certainly what I would suggest, if you have some concerns about the chamber meeting on Thursday, you make contacts with the governance team and to raise that concern. But certainly in terms of our service offer and our delivery, as you heard from Ainsley earlier, we work to the guidance that's issued to us from Public Health England and the government.
Yeah, there will be additional ventilation, and the room outside will be made open for councillors to use as well. Okay.
I accept that, Melanie, okay. And I agree that it's not in your remit to sort that. But should it really be up to us as individual councillors to go to governance, or should it be then to come to us to give us the assurance that we're going to be safe on Thursday? Because I'm not so certain that I am going to feel safe on Thursday, sat in here with 80 people, some of whom will not be wearing masks. I know they don't have to do, but their government guidance, and I say there because empirical observation from Parliament is that it's a particular party that doesn't wear masks. I don't feel safe sat in a room with 80 other people, of which 40 odd are going to be sat there without masks. End of. And I've not seen anything from this council to convince me otherwise.
Thank you, Councillor Carr. Okay. Councillor Henshaw.
Thanks, Chair. It's not in relation to that specific point. I mean, I understand where Councillor Carr's coming from, bearing in mind that infection rates are going up, hospitalisations are increasing, and Dr. Dodd, you'd tell you this pandemic isn't over. It's far from being over, and that's why I'm wearing a mask. I mean, colleagues at work are now who've been doubly vaccinated have come down with the virus. They're not particularly as ill as they would have been if they hadn't had the vaccine, but it is still a concern. And I too take the point in relation to why don't we have hybrid meetings in relation to council, because officers quite rightly can do remote meetings. We could do a similar sort of thing, but I'll be wearing a mask on Thursday, and hopefully we won't be in an environment where the virus will be spreading around, because as somebody that's had the virus prior to being vaccinated, I wouldn't wish it on my worst enemy, because it's a very serious illness and debilitating. That brings me on to the point in relation to our workforce in the report. Obviously, our workforce have done a fantastic job throughout the pandemic, and I comment that the work that they have done, I mean, it's been totally difficult circumstances, but they've worked on and represented this authority to the highest standards. But in relation to our workforce that have actually contracted the virus, do we know if there are any individuals, I don't want names, but individuals who have contracted the virus and now are suffering the long-term effects of long COVID? I mean, obviously it's something we need to look at and support our staff that have been very often on the front line. When we look at the report, yeah, I think there's a lot of interesting things, and we welcome the spending. On paragraph 21, where it's been mentioned about recruitment and retention is a real issue, and we know that that is a problem right through and right throughout the care sector. Retention and recruitment, not only for us, and I know we've put one or two initiatives forward to try and on the last committee we had a list of vacancies that we were hoping to fill and get out there and get new people working for us. But it is a major problem throughout, and perhaps we'll talk about that later on, how we as an authority can try and mitigate the circumstances in relation to the problem that care providers have in recruitment and retention. I've got my own ideas why that is, and I might share them with people later on, but overall, yeah, we will be supporting the report. Thanks, Chair.
With regards to workforce and the effects of long-term COVID, it's a good question. I can ask that and share that information with all members outside of the meeting. Okay, thank you. Councillor Welsh.
Yes, this is regards to paragraph 17, where it's talked about there was a larger scale where it would break out 286 outbreaks, which was the larger scale than in wave 1 in total across care homes. It was just really with regards to an update where we are now with regards to outbreaks in care homes, whether there is some reassurances now that people aren't coming out of hospital possibly infected with COVID back into care homes, because that would be absolutely disastrous again. So it's some reassurance with regards to that we're ensuring that that doesn't happen. And then on the top of that, with regards to an impending winter crisis, which I think we're all in agreement is impending, it's not if this is going to happen. We've already seen 5.5-hour waits down at the walk-in centre the other day, 4.5 hours with a 5-month-old baby, which should have been a priority. So we are seeing the rise of respiratory illnesses. I got a text message the other day from the NHS about child respiratory illnesses. So with 286 outbreaks, where are we with the outbreaks, and how are we feeling with regards to the impact of these respiratory illnesses, further outbreaks of of COVID, and will that have an impact in who is coming in and out of our care homes, and what kind of impact will that have? And this kind of relates to, and I'm just going to skip to the page, the recommendations, where it says number 4, where it says on a temporary basis into March 2022. That actually seems like quite a long way away, but for me it's not, and especially if you're recruiting from outside, if we're thinking that this is going to be carry on and there's an impending crisis and there's a higher need, is this long enough, is what I would say. Is it, or is it just going to come back in a couple of months saying let's extend it? Because it'd rather be that we get someone really good for the job, and then more likely if it's maybe a bit longer. I just wanted to ask that as a question. So, and similar to Councillor Paul Henshaw as well, with regards to recruitment and retention, there is a real need out there, and it's my understanding there is a real issue, a very, very serious issue with regards to recruitment across the care sector, not just in Nottinghamshire but actually nationally. And if the government doesn't get to grips with this, we'll have an even worse impending crisis, especially this winter, with how we care for people.
Thank you, Councillor Welsh. With regards to the I'm going to hand over to Cash in a second, but with regards to temporary contracts, they will be reviewed. A lot of what you've asked as well will be covered in the market management statement later on in the meeting. So I'll hand over to Cash to answer it now, but obviously we're going to be duplicating ourselves later on, unless you want to wait. Are you happy?
I'm more than happy to wait. I was in two minds when to ask it, so
okay.
I apologise.
Yeah, no, it's fine. No. If we can,
happy to wait. Happy to wait. Yeah.
As long as you're happy. Any other questions, Councillor Lee?
Chair, I just wanted to clarify something that Councillor Carr said a minute ago. Is I believe it was less than 5 people at the last full council meeting that actually wore masks, and me being a disabled councillor in this chambers feel completely safe being here. And happy to do so.
Thank you. Neither was I. I was isolating. But we can have a look at. It's out there, isn't it? Okay. We'll now move to the vote. Everyone's happy. So. As we've had a good debate, the recommendations are set out. I shall take the vote with a show of hands. All in favour? Unanimous. Thank you. Okay, we'll move to agenda item 6. The adult social care performance and financial position update for Q1 2021 to 2022. Adult social care and health continues to respond to the demands of the pandemic, and this means that performance in some areas has been affected by the end of the Q1. The report picks up on work underway to address this impact and highlights departmental success in recruiting temporary staff to support recovery, as well as referencing work that has been progressed during Q1 in relation to the department's cultural change programme. In the implementation of the strength-based ways of working with people and the owning and driving performance programme, supporting staff to take more ownership of their performance and well-being. With temporary resources approved, we anticipate performance to improve during Q3 and Q4. Therefore, I move the recommendation as set out on page 5 of the report. Do I have a seconder?
I'll second those, Chairman. I reserve the right to speak.
Thank you, Councillor Carlton. And back to you, Cash. Thank you. If you want to. Thank you.
Just going to pick up on the performance in terms of Q1, as the report does clearly highlight that we are facing a number of challenges in various different performance areas, and quite a number of those have been highlighted in July's meeting in terms of the pressures around mental health, around safeguarding, and our response to other areas such as employment. They're all have been highlighted as areas where we need to see further improvements. Significant mitigating factors have been really is the increased demand due to the impact of COVID, and committee approved a series of proposals and measures to increase capacity in our frontline services to respond to that. Ainsley and Sue's teams are progressing with that recruitment of temporary resources, and so we're anticipating that we're able to respond to the current demand and also see further improvements in Q2 and 3. We anticipate we should see some further improvements as soon as we're able to get that resource in place. So that is essentially where we are at the moment. Obviously, we are similarly to the NHS. We have got considerable impact on adult social care services due to the impact of COVID. What I also would want to highlight is, alongside performance, what we have got some really good developments that will support our performance going forward. For example, the strength-based approach and the 3 conversation, the innovation site, that's really progressing really well. The initial feedback from people with lived experience and carers has been positive, as well as the feedback from our staff. And again, that will support us going forward. But also, I also want to highlight that some of the work around simplifying processes. So we recognise some of our processes are not as streamlined or as they can be. And again, there's been significant work to ensure that our frontline staff are working on the front line rather than spending more time on our complex systems. And that, again, has had initial really good positive results. And again, also finally, I would also mention that the owning and driving performance is one of the key pillars of our cultural change programme. And again, that's very much about supporting and empowering our staff to own and drive performance going forward. So I would, as a combination of our temporary resources and our transformation and cultural change programme, we would expect and anticipate further improvements in our performance overall, but recognise that we are currently facing significant challenges due to the impact of COVID. Happy to take any further questions.
Thank you, Cash. I think it's a great report. I think the owning and driving performance strength-based approach is definitely the way to go. I'm going to open it up for questions. Do we have any?
Chair.
Councillor Henshaw, please.
In relation to the report, clearly states, I mean, we always get back to the effect of COVID, and the reasons why we've got the underspend is a direct result of the COVID pandemic. Is that correct?
Yep.
Yeah. In relation to going forward, and I agree with you that is a good way to move. Do you think that, Chair? Do you think that the budget or the recommendations outlined will continue to meet the needs of the people of Nottinghamshire during this forthcoming winter? Because obviously pressures are increasing again, and we may have to respond slightly differently to how things are going, because like I mentioned earlier, the pandemic's not over, and I think there's going to be future and significant pressure again. And we may be coming again at a future meeting looking at another problem with an underspend. But overall, we welcome the report. Thanks.
Thank you. No, thank you for that. No, I did mention in the prelude about the Q3 and Q4. So this is just the first 2 quarters. So, okay, but we will see, won't we? So I've got no more questions. The report has been moved and seconded. Can we go to the vote? All those in favour? Is that good? Thank you. Better. Right. Thank you. That's unanimous. Thank you. Agenda item 7 is the establishment of a post of Deputy Director of Public Health. Ensuring that everyone in Nottinghamshire is able to live safely with COVID-19 and other communicable disease threats will require greater attention to and scrutiny of health protection arrangements than capacity in the local system has allowed in recent years. In order to strengthen the resilience of the public health team in delivering against our duty to protect the health of the county's residents, we are proposing to establish a Deputy Director of Public Health role. Aside from health protection, the role will help improve outcomes on other public health agendas, working alongside senior officers at the council, our integrated care system partners and our commissioned services. The cost of the role can be contained with the public health grant and therefore represents no additional burden to the council's medium-term financial strategy. I move the recommendations as set out on page 81 of the agenda pack and ask for a seconder.
I'll second those, Chairman, and reserve the right to speak.
Okay, and I'll hand over to Melanie. Thank you.
Thank you, Chair. I don't think I have any further comments because I think committee today has well made the case for us requiring an ongoing COVID response as part of our leadership of public health. So I don't think I've got anything to add, but happy to answer any questions.
I'll go to questions. I think this Councillor Carr, you raised this earlier on about what we're planning for the future working with public health, and this goes some way to answer your question. But then I've got Councillor Martins indicated. Thank you.
Yeah, thank you, Chair. I welcome the report. I'd just like to lay on record my thanks and gratitude from the residents of not only just Ashfield but the county for the fact that we had Jonathan Gribbin as Director of Public Health during the past 18 months, because he's done an absolutely excellent job. Nobody could have expected to have had to face that. And even during the darkest hours, he was still answering emails, which may have seemed immensely trivial considering what the role he was playing, and he still took the time to answer those emails. And I think he did an excellent job, and he deserves the praise of this committee for his efforts during that pandemic period. Thank you, Chair.
Thank you, Councillor Martin. I'll see that vote of thanks put on record, and we acknowledge that. Councillor Carr.
Yeah, I'd like to agree with that. Very often, people at the top can be a little bit remote from what's going on, but our Director of Public Health was anything but. I'll give you an example, very quick example, in that it soon became very apparent that my division, or part of my division, the Beeston North part, vaccination levels were very, very low compared to areas around it. And I telephoned Jonathan directly, picked the phone up, which sometimes doesn't often happen with senior people, and said, is there any way we can get the vaccination bus down here into the car park at Central Avenue? And within a week, we had the vaccination bus at Central Avenue Park, and it was very successful. It ran out, actually, vaccine. So I would like to thank that. If this position is going to provide even more of that direct approach, then I will support it. But I will be watching it because, you know, we could have several staff for £130,000 rather than just one person. So I will keep an eye. I will support it, but I think I'll be keeping my eye on how a performance improves.
Okay. Thank you. It is an extremely specialised position, and it would be one that's very difficult to recruit to as well. So, Councillor Henshaw.
Yeah, I concur with my colleagues. The Director of Public Health has done an exemplary first-class job during the pandemic and pushed things forward and been contactable, which is sometimes not the case for people in those sorts of positions. But we're looking at this role, and as Councillor Carr mentioned, you know, £130,000 is a good salary, or something that, from our point of view, we're looking at, and we will be watching how things develop in relation to this. Just one point in relation to the report, the professional registration requirements in paragraph 10. I'd just be interested in somebody letting me know, or letting the committee know, what that is. And bearing in mind that not only as our director and all the staff done an exemplary job during the pandemic, but let's not forget the frontline care staff who've worked exceedingly hard in difficult circumstances and very often just for the living wage. So that's the other side of the coin. But in saying that, we'll support it, Chair. Thank you.
Thank you, Councillor Henshaw, and I echo the thanks to all our frontline, in fact, all of our staff and officers who have worked immensely hard, and having met with some on Thursday in our enablement team, how they've stood up at last minute and done an amazing job. Okay, thank you, Councillor Doddy. I was just going to move to the vote then.
Yes, thanks very much indeed. The Public Health Department, although doing a fantastic job throughout COVID, is just about to come up with an even bigger challenge, as all the things that existed before COVID have multiplied. The obesity challenges, the diabetes challenges. We've had the greatest single number of people dying from alcohol-related deaths. You've got depression on the rise, suicide on the rise, drug abuse on the rise, cocaine use going through the roof, domestic abuse going through the roof. Sorry? Measles. Well, it's fallen into sort of some obscure place behind all the rest of the illnesses. But it is interestingly 14 times more contagious than COVID is measles. So if you look at the sheer requirements of the Public Health Department going forward, it'll take years to get on top of that. So I think that this is just the beginning of what we need, but we can't see public health in isolation. It's through the ICS and through its partnership working is the only way we're ever going to be able to tackle this backlog of a tsunami of health-related issues, which will continue for years to come. I suspect that this is the first of many increased appointments that will be required over the coming years. Thank you.
Thank you, Councillor Doddy. Councillor Kerry.
Yeah, I completely agree with Councillor Doddy. If you refer to paragraph 12, item D on page 81 of the full reports pack, it clearly states take responsibility for the strategic objects of the local authority and the Health and Wellbeing Board and act as a change agent to enable delivery of relevant outcome indicators from public health, NHS and social care. And with the Social Care Act coming through, all these kind of things coming together, the responsibility of that team to improve the health and wellbeing of Nottinghamshire in the years forward, I see this as a very proactive move. And just in terms of the 130,000, I don't think that means 130,000 salary, Councillor Henshaw. I think that means including all the add-ons and everything else. Thank you.
Good point. Well made, Councillor Kerry. And I do seem to be spending an awful lot of time with Councillor Doddy at the moment.
You'll be a very fit man at the end of it.
Okay, right, that has been moved and seconded. Can we please move to the votes? And I'll take the vote by show of hands. All in favour? Unanimous. Thank you. Agenda item 8 is investing into the Healthy Families programme. One of our priorities is to give children the best start in life, reflected in our Best Start strategy 2021 to 2025. The first 1001 days from conception to a child's second birthday are a critical period where the foundations for virtually every aspect of development are laid. The parent-infant relationship is key to healthy brain development, but evidence shows some parents need extra support with this. We're intending to add a specialist health visitor to the Healthy Families programme contract. A second member of staff will be redistributed from within the existing contract at no additional cost to create a small team with specialist local knowledge and skills in the parent-infant relationship. I move the recommendations as set out on page 88 of the agenda pack. Do I have a seconder?
I'll second those, Chairman, and reserve the right to speak.
Thank you, Councillor Carlton. And we've got Louis. Oh, we've got Kerry. So I'll hand over to Kerry.
Thank you. So The paper, as it stands, brings a request for investment into the contract for the Healthy Families programme, and that's what used to be known as the Health Visiting and School Nursing Service predominantly. The request is focused on actions to improve the parent-infant relationship, and it's got a value of £97,673. If supported, this would be funded through public health reserves, and there may be a future paper bringing requests for public health reserves, but this is brought ahead of that because we don't want to delay the plans for these very early years, because we're very mindful that during COVID there's been quite a significant change to the family relationships for new families, and really want to be able to latch onto that first 1,001 days before that first 1,001 days runs out, really. So we know that the evidence base tells us that what happens in that time from conception to a child's second birthday are an absolutely critical time for development. It's known as the first 1,001 days. And the parent-infant relationship is particularly important for the healthy brain development, because the developing brain is shaped by the interactions between the baby and the primary caregiver. The better the quality of that relationship and interaction, the more positive the impact is on the child's development, particularly on their social and emotional development. And at the moment, it's estimated that around 15% of parents need support with the parent-infant relationship beyond the scope of universal services. It's a very skilled piece of work that falls under the umbrella of early intervention and prevention. And we recognise that that 15% that's actually quoted in the evidence isn't 15% in the here and now, that's in response to COVID. That's pre-COVID levels of requirement. So the funding proposal will actually fund one specialist health visitor for 18 months and some associated training. We aim that that health visitor will work alongside one further whole-time equivalent health visitor who will be drawn from the Family Nurse Partnership Programme, and that currently exists within the financial envelope of the Healthy Families contract. These two clinicians will introduce some extra capacity into the Healthy Families service with two key functions. The first one is to deliver a low-level targeted intervention to parents aimed at strengthening the parent-infant relationship. And the second one is to help us to define locally what the need and demand is for further parent-infant relationship work. But we know from the evidence that we currently have that there is a local need for this. After we've done this scoping work as part of this pilot programme, we'll then look towards a more integrated permanent offer if that's what the data indicates that we need locally. So strengthening that early parent-infant relationship is a priority within our Best Start strategy, and it's also reflected in national policy in a recent Andrea Ledson report that again focuses on the best start in life. There's good evidence to, there is a really good evidence base for the work to strengthen this relationship at both a targeted and a specialist level. But what we're suggesting at this point in time is a targeted approach to this work. All health visitors are going to undertake something called Brazelton New Birth Observation Training. And that's going to mean that an assessment of parent-infant interaction will be universally offered to all families at the birth visit. And it will be this observation tool that will be used to identify families in need of targeted support. There's more information on that in paragraph 22 of the report if you want it. So in summary, it's a request for a relatively small amount of additional capacity into the current contract to enable us to undertake the scoping exercise to look at local need for parent-infant interaction work. I'm happy to take any questions.
Thank you, Kerry. I think identifying the local need is paramount, isn't it? And this targeted based approach. I'll open up for questions. I've got Councillor Fielding first. Thank you.
Thank you, Chair. Certainly welcome this report. It's an area that I was involved in early years, so as I say, it's something I do know a little somewhat about. And I also welcome in 25 that you're bringing forward a new mental health service that will support women who've experienced trauma relating to pregnancy, birth and fertility. I'm also involved in a long time in a charity called Joel that supports women who have lost children through subsequent pregnancies. And it's something that, as I say, we need to be supporting women. And certainly I'm absolutely aware that within the division I represent, It's not just in the deprived areas where we've got a high proportion of postnatal depression, and that's been even worse through this pandemic. And the support that we also need to be giving to young families who have a near neighbour whose little one has had no social interaction with others due to not being able to go to things that you would have expected. We've an awful lot of work that needs to be happening in this sector, and an awful lot of people that if we don't get the support in now, we're going to be altering the life chances of a generation because of COVID. But I welcome this.
Thank you for that, Sybil. It's a good point, well made, that it's been a misconception for years that these issues are only in deprived areas, and depression doesn't take place, and you've got some very affluent areas where they get forgotten almost. Yeah, the intervention needs to be there, and that's why it's a targeted approach. It's not a one size fits all. Got Councillor Welsh next. Thank you.
Yeah, people won't be surprised that I'm going to talk something about this, because it's something that I've been going on about for quite a while, and something that I feel very passionately about with regards to the work that I do on a voluntary basis. So I very much welcome this, and thank you for bringing it forward. It really is appreciated. Councillor Fielding did touch on it, and without repeating myself once again, there are lots of women out there that have had babies during the pandemic, and time is ticking. So even if I think about the fact that I had my little boy at the beginning of the pandemic, he's now 18 months old. We've been quite lucky in the sense that we've been able to send him to nursery, so he has had that interaction with other children, but that's not always been an option. And there are a lot of mums I know out there that are still quite isolated and quite worried about their children's language development. So anything that comes out of this which helps support women perhaps on a less targeted approach, but making sure it's meaningful, if that makes sense. So there's a lot of women that would perhaps not think that they would become under the umbrella of a targeted approach, or might not come forward, but might actually be the need there. And again, I go back to perhaps some events where people, mums and babies, could perhaps come together with perhaps this health visitor, even if it's just once a month at some of the children's centres, so they can come together and have those discussions and just have a bit of reassurance with regards to their children. But something like that would be very useful, and I know from the group that I run that people, it's one of the things that they come forward with. So really grateful, really support it, think it's absolutely fantastic, and anything else that comes out of this would also be greatly welcome. And again, we would be willing to help with regards to, if you need help with regards to women and where they are, except of course I will support with that if I can. The other question, the question that I have actually relates to health visitor capacity, because I think this has been an ongoing issue across Nottinghamshire. Without using my own example again, I was an hour on the phone last week to get in health visitors, and still no one answered the phone. And my child has got a certain condition as well, where you would expect that. And I ended up ringing the GP, and I know the GPs have had a lot of stick recently, but it was those that actually resolved the situation. So when you do talk about the specialist health visitor and the family nurse, I would be interested to actually see if that actually gives yourselves enough enables you enough capacity to actually do what you want, because I'd hate for us all to put our hand up today and actually it doesn't allow you to deliver what really needs to be delivered. Yes, and just to go over again, the first 1,001 days are absolutely critical, and I know mothers, fathers feel a lot of pressure with regards to that, because it is, such a critical time, and I really do welcome that. Yes, any help that I could do with regards to it, or our lockdown mum group, then please just contact us and we'll be gladly help with that. So thank you.
Thank you, Councillor Welsh. Always good to hear you. You're something you're very passionate about, and it's always good to hear. And you're the first one to actually mention not just support of women, but there are fathers as well. So, yeah, myself being one. I've got Councillor Doddy.
Yes, thanks very much, Chair. Just following on the comments from Councillor Feeling and Councillor Welsh with regards to support for this. I remember being here a number of years ago when we first introduced the family nurse practitioners, which were selectively targeting first-time teenage mothers based on a Colorado model, which had been shown to significantly improve school readiness in those kids. And I've seen that model in action ever since, and it's a really, really effective model where we set out to target very vulnerable areas in order to give them support during pregnancy and also for the first 2 years of life. And that has significantly improved the school readiness of those children. So I think these type of approaches where we target people who have the greatest needs usually produce the greatest benefit and outcome overall, and I think that this is one such model. I felt incredibly sad for anybody who had to give birth over the COVID period of time, with the lack of access of support from partners, with the challenge of staffing because of the number of midwives, etc., who were off, with the lack of face-to-face contact, with the sheer potential to be on your own during one of the most vulnerable periods of a person's life, giving birth. So I do hope that this targeted intervention is as successful as the primary care first contact practitioners that were introduced, and I think targeting is a really good thing. I hope it brings about more face-to-face contact, which is worth any amount of remoteness, and bearing in mind that all of the same problems that affected the general population affected people who were pregnant. There was an increase in smoking, there was an increase in alcohol, there was an increase in drugs, etc. And all of those were magnified by isolation and depression, etc. So I very much welcome the intervention. Thanks.
Thank you very much, John. Okay, I've got 3 more speakers. I've got Councillor Carr.
Yes, thank you, Chair. Postnatal depression is a huge problem outside of a pandemic, and yes, I have experience of it from my and yes, it's devastating for the mother, but it is also devastating for the father. And I can actually relate to it because when my son was born, he was 13 weeks early, and my wife had eclampsia, and she couldn't be moved out of the labour suite for over a week. And then in another part of the hospital was my son, 1 pound 9 ounce, on virtually wires everywhere. And I was just going from one to the other and one to the other, and it was an absolutely terrible time. So I can relate to it. In that regard, I just wonder, unless you've already got somebody lined up for the job, whether a fixed term contract is going to actually attract somebody with this speciality. Because I don't know, I know that employers are struggling to recruit at the moment big time, but quite honestly, I think this is that important that I must just support it, but I would have liked to seen it as a permanent role.
Thank you.
Yeah.
And Kerry, do we have any?
In terms of the recruitment, the Family Nurse Partnership practitioner that we're suggesting is one of the 2 whole-time equivalents, is already skilled and trained in parent-infant interaction. Part of the funding will fund the training for the additional person, and we're anticipating that person will be drawn from the existing Healthy Families teams who has a special interest in parent-infant interaction, and then that more generic health visitor post will be the one that's backfilled into with somebody that isn't necessarily specialised or qualified in this area. So we're not anticipating any challenges in terms of recruiting into the post, but I certainly welcome your support and recognise that we would hope that if this demonstrates what we suspect it will demonstrate, we will be possibly coming back for a more permanent role.
Thank you, Steve, for your question and for sharing your experience. That's very brave. Okay, Councillor Henshaw.
Councillor Carr, asked something that I was going to incorporate in my question in relation to the, the longevity of the position or the future permanence, which I think, is the correct way to go. And it's in relation to, I mean, years ago, it was standard text for a sociology degree, looking at attachment and learning. And from 40 years ago, the benefit of early attachment to parents for the development and future of a child was acknowledged. So I think it can only be a good thing. And as has been mentioned, it says in paragraph 27, parents who are tuned in are able to support their baby's needs. Parents. So it's across all genders, and anyway, we support it. Thank you.
Well, I've got two more. Councillor Martin.
Yeah, thank you, Chair. I'll be brief because Councillor Doddy covered it very eloquently. My question is considering the fact that this is a county-wide scheme, will this actually be enough to solve the issues? Because obviously, I know for a fact in Ashfield we had the highest group of pregnant mothers smoking under 30 years old, throughout the county, and postnatal depression is a big thing. And after the pandemic, will this actually be enough to solve the issues, or is it just a sticking plaster, really?
At the moment, the purpose of this is going to be to scope the need more than anything else, so that we identify exactly what size of team we might need moving forward. There are various models around the country for parent-infant interaction teams, so we want to be sure that what we get for Nottinghamshire is absolutely the right fit. We recognise that there will be some areas where we have greater need than others, but I think, one of the councillors already mentioned that parent-infant interaction challenges aren't necessarily restricted to areas of higher need, and it is a county-wide offer that we're initially going to go for, and then we'll be able to, once we've identified what the need is, we'll be able to demonstrate more readily, I think, using the data to tell us exactly what it is we do need, because although we're going to put this firmly in the Healthy Families programme at the moment, it may be that there's an opportunity to expand that beyond Healthy Families and look at the way in which we can think about it on a more system-wide level. So yeah, it is a small team, it is a bespoke team. They're going to be very highly protected, and their referrals will only be coming from one source at the moment, and that will be the Brazelton New Birth Observation tool. So that will protect them in terms of what comes through, but it will give us the opportunity to actually identify what it is we need moving forwards.
Thank you. I'm going to take Councillor Kerry.
Yes, just very briefly, agree with the comment about parent. I mean, we live in a complex world, and it's parents. The term parents is maybe wider than some of the things that have been said today. I mean, I live in a world where we have grandparents looking after children a number of days a week when the parents are working and doing other things. So I just wanted to know whether the system would pick up any issues in relation to that part of a family unit.
Initially, what we'll be looking at is the interaction and the relationship between the baby and the primary caregiver, whoever that primary caregiver may be. So if it is a child that lives with a grandparent and the grandparent is the primary caregiver, then that will be where the observation takes place. On the whole, we expect it will be with a parent, because that's usually the case, but it doesn't exclude the opportunity to work alongside other people.
Thank you for that, Kerry. The onus is on the parent. So, an extremely emotive subject, and we had a really good debate, but I will bring it to a close now and ask to move to the vote. So all those in favour, can I ask, raise your hand. That's unanimous. Thank you very much. Okay, let's move to agenda item 9. It's the Home First Services Framework Agreement tender for 2021. The Council commissions hospital discharge, crisis response service and carer support service as part of its suite of home-based care services. These services provide crucial support to people being discharged from hospital and are our partners in the NHS who are under increasing pressure in the acute hospitals. These services are regarded highly by people who use them in terms of the quality of care, timely response and user experience. In addition, these services have demonstrated a number of system benefits. For example, they support timely discharges from hospital, improve flow between hospital and community, prevent admissions and support people to regain their independence and improve their health and well-being. Approval for the retendering of these services required as the current contract is due to come to an end. The tender process will be managed to achieve the best outcomes for people who use the services and the council. I move the recommendations as set out on page 7 of the report. Do I have a seconder?
I'll second, Chairman, and reserve the right.
Okay, thank you. And just hand over to Cash. It is just as I've already alluded to, it is to ask that we go to tender. We're not going to be discussing the contract here, so but I'm sure Cash will pick that up now. Okay, thank you.
Thank you, Chair. I think with that introduction, I would just add, I think that's a really comprehensive introduction around what the proposal is, which is to seek to recommence a tendering process. So this is a tendering process very much is around take a strategic approach, take a step back and understand what's working well, what's not working well, and ensure that what we develop a future model is fit for purpose and it's ensures that it achieves our strategic objectives going forward. What I want to just very briefly just mention, as the Chair has already covered, that the framework comes to an end. It comes to an end, and what we do need is a new contract, a new framework in place from April 2023. So the retendering process is quite a lengthy process where we undertake a review of all services, undertake a comprehensive engagement process, and so that commencement needs to start fairly soon, really, in order to make sure that we have awarded a contract by and for a new service, new agreement in place for April 2023. I also want to just very briefly mention that we are seeking, as part of this tendering process, is a longer term contract. I think some of the successes that we've had with these services is that we've had these services on a longer term contract do provide sustainability and continuity. And again, with these longer term contracts, we do built in breaking points. So if there are changes, we can always exercise those. So that's a key point. The other element around the tendering process, again, is that you've often heard from previous tenders that we're proposing is to take a competitive dialogue process, which essentially is an opportunity to have dialogue with potential bidders to really get underneath the details of their bid and the proposals and their capability. And it gives us an opportunity to shape and develop those services in partnership with potential bidders. So that's a process. It is time consuming, but it also gives us the opportunity to really understand potential bidders in terms of how they would take these services forward. I think Nottinghamshire is quite lucky to have a range of arrangements around home first services as outlined in the report. What I would also do is invite Sue to just share her observations and thoughts around these services, because her internal services and her reablement service do have significant interface with these commissioned services. So I would invite Sue just to share her thoughts, particularly around the work and the vital role these services play in supporting people in the community and also supporting discharges.
Thanks, Cash. So these are a slightly different sort of home care service because they respond really rapidly to people either needing to go home or in crisis in the community. And there are a number of different services, and we are looking at how they work together closely just to make it as simple as possible for people who need them. And we've got occupational therapists in our reablement service who work closely with these services to make sure people are getting the right elements that they require. We also work really closely with our health partners, both in the community and in the hospitals, looking at how we can simplify some of the processes for people accessing them. So happy with Cash to pick up any questions. Thanks.
Thank you to Cash and Sue for that. It's self-explanatory in that report, isn't it? But I will open up for questions. Do we have any? Councillor Carr.
Yes, thank you. On Thursday, we've got a very important paper to debate on the future for devolution within the county, and the way that it looks like it's going to go in is devolve powers for the county and the districts and boroughs in the area. And this is one where the interaction between the boroughs and the county is going to be pivotal, because of course the boroughs and the counties are responsible for both for private sector housing and also their own housing stock, if they still maintain it. And a lot of the boroughs and districts have different policies on adaptations, for example, and things like that. So that would be a fantastic opportunity to align those so that it could be even smoother than this suggests as well. So I think obviously we have to go to tender, so let's get ahead with it. But I think we need to be aware that we may have to be a bit flexible, because this is a long-term contract and this all might happen in the next 2 or 3 years. So there's going to have to be a deal of flexibility there, I think. I wondered whether we'd thought about that. Mind you, having said that, this devolution bill's has just been landed on us, really, hasn't it?
Thank you, Councillor Carr.
So what I can assure is that we work very closely within the local communities and patches. So our teams are aligned to the primary care network. So we are increasingly looking to work at very local levels. So, and I would also welcome anything we could do with our partners responsible for adaptations and housing. We already do work with them, but anything that can enhance that to make sure we get the right sort of services available for people at the right time would be very welcome.
Okay. No more questions, no more speakers. Been moved and seconded. Should we move to the vote? Can I have a show of hands for all in favour, please? Unanimous. Thank you. It's carried. Okay. Agenda item 10 is the Autism Pre-Diagnosis Support Service. Through transforming care partnerships, local authorities with their clinical commissioning group partners have been working on a programme to support discharges from long-stay hospital for people with a learning disability and or autism. Through the development of community-based services, Nottinghamshire Transforming Care Partnership has been successful in discharging and repatriating people closer to home. Nottingham and Nottinghamshire Partnership has been successful in receiving £84,000 to develop pre-diagnostic support people for those currently on a waiting list at the Neurodiversity Support Service. There is also potential for further money available through the Transforming Care Partnership. The proposal is for an information, advice and guidance service at pre-diagnostic stage, including virtual support mechanisms, apps and the development of a website to provide early support and prevent problems escalating and to avoid future crises. I move the recommendations as set out on page 4 of the report. Do I have a seconder?
I'll second them, Chairman, and reserve the right.
Okay. Before I open it up to any questions, I'll hand over to Cash, who can pick up anything I've missed. Thank you.
Thank you, Chair. Just to add to that, essentially the Transforming Care, the Nottingham and Nottinghamshire Transforming Care is a national programme for people with learning disabilities and autism. It's not doesn't just focus on repatriating people from long stay hospital to closer to home. That's a significant programme of work, and we heard about some of those developments in the previous committee meeting. But also it's also about improving outcomes and improving access to support services. And one of those is around diagnostic services around autism, which has in a lot of health and care economies has been quite a challenging area for diagnostic services, particularly for health commissioners to ensure that it has sufficient capacity. And from my experience, I've for the last 6 or 7 years, I've recognised that that's an area that hasn't fully been resolved in a lot of health and care economies. And again, health commissioners are working on that front. What this pre-diagnostic support service recognises that there are significant number of people that are waiting for diagnostic, and the pre-diagnostic service will essentially offer support and intervention and intervene early around any crisis and support people while they're waiting for that diagnostic support. So we were, as a Transforming Care partnership, we were invited to bid for these monies, which we've been successful. And I think this is a really good news story that we can actually use these resources to develop this service in partnership with health, but also with the voluntary community sector to ensure that we have a pre-diagnostic element around this. So it's a positive, good news story, and I think it will make a huge difference to those people that are and those families that are waiting for those diagnostic services. Happy to take any questions.
I've got Councillor Martin first. Thank you.
Yeah, thank you. Yeah, I fully agree with what you're saying, Cash. It's been a very difficult service to manage over the last few years, and residents particularly find it difficult to access this pathway. So anything that enhances and shortens the route to resolution is surely to be welcomed across the county, and it is a good news story. And it's good to see that we're working to enhance that service. Thank you, Chair.
Thank you, Councillor. It's signposting, isn't it? It's doing exactly that. Those people that find difficulty in accessing the service. Councillor Doddy.
Yeah, just very quickly. I was speaking to one of my partners this morning about this before I came here, and it's generally felt that the diagnosis is the key. All of the families I look after, all of the mothers, the fathers, the families, they want to get the diagnosis because the help follows the diagnosis, and that then frees up their opportunities for other interventions. And one of the other GPs just simply said, if you've got money, you've got a big delay in actually the diagnostic service itself, why not just put the money into the diagnostic services and try and improve their turnaround and their ability to get people through the system and diagnose them, because that's really what the parents are after. And that was just a simple observation that somebody made to me today. There's obviously an answer for that, but I don't know what it is.
Yes, so I think it's a really good question, and it's definitely something that I can pick up with health commissioners in regards to this. But what my experience in commissioning diagnostic services for in my previous role with the CCG is that actually there's a workforce challenge. So when you have temporary one-off monies in order to recruit consultants or specialist nurses in that pathway is incredibly challenging, and it's challenging just generally if you have recurrent funding. But with temporary funding, it becomes even more challenging. So I suspect that would be one of the barriers and challenges. And also, I think you're absolutely right. I think we do need to continue to ensure that from a health perspective, that there is sufficient resource to commission the diagnostic in terms of the demand. This is an emerging need. It's an emerging need, and most diagnostic services have experienced challenges around this, so yes, so it's a really good point, but I suspect the workforce is one of the biggest challenges around this.
Thank you, Cash. Yeah, let's remember that it's a successful bid, and it's money that's coming in. Exactly that. So we've got to give it a go. Councillor Henshaw.
I agree, Chair, with that totally. Very often you find that one of the main difficulties in relation to an autism assessment is the circle of support that are actually undertaking the assessment, which is to make the assessment effective. It's got to be inclusive not only the parents and health professionals, but the individual if they've got capacity as well, speaking of adults. I think this will help, what we're passing today will help in relation to the diagnosis, the actual diagnosis of the condition of autism, because Cash and other members will know it's very often very difficult to get an autism assessment and diagnosis, and there tends to be a waiting list for people to actually access that, which is a problem in itself. But other people in this situation, you know, they're struggling, and anything we can do to help with the assessment and diagnosis, and I think passing this today will do that. So we'll be supporting it, Chair. Thank you.
Thank you, from the Chair. Okay, I've got Councillor Carey. Did you indicate to?
Yes, I did, Chairman. Thank you. Just a question. This is designed to help in that process of diagnosis. It's not a silver bullet that will solve all the problems, so I do support it. Just one question, however, and it relates to what Councillor Doddy said. I mean, this is adult. I believe this is adult pre-diagnosis, not children's, and I would assume, I hope, that should there be any significant autism being observed, and that the priority will be given, and triage or whatever you call the system, that those with serious need will get seen. So I think it's in cases where there's underlying autism that's not easily recognised, but that diagnosis would help that person in terms of that. So I understand what you're saying, but it's not the critical kind of care size that would happen elsewhere. Thank you.
Thank you for that, Councillor Carey. I'm sure. Okay. Any more questions? I know Councillor Martin's got to go, so just before you go, shall we move to the vote? All those in favour, show of hands. Thank you. That's unanimous. And if you want to make your way, thank you. We'll move to agenda item 11, and that's the market management position statement. The quality and market management team has continued to provide excellent support to the county's care providers in dealing with the impact of the pandemic. The team is still providing support in relation to COVID-19 outbreaks in the care sector and working with providers to implement mandatory vaccinations of people that work in care homes. The report provides examples of initiatives in progress to address the challenges in relation to the social care workforce and to improve the quality of people's experience of care, as well as a regular update on the current position in respect of social care providers that have had their contracts with the council suspended. I move the recommendations as set out on page 117 to 118 of the agenda pack. Do I have a seconder?
I'll second, Chairman, and reserve the right.
Thank you, Councillor Carlton. And I'll hand over to Cash again. Been very busy. Thank you.
Thank you, Chair. I'm going to ask Gemma Shelton, our Group Manager for Quality Market Management, to provide an overview of the report.
Thank you, Cash, and thank you. Just in terms of an update in response to what Councillor Welsh said, I think I will cover an update in terms of what the task force, which I reported back in July, and previous reports. So since our July update, the task force has had to stand up in terms of its regular occurrence. So we're meeting on a twice weekly basis to support not only the small increase in outbreaks, which they are smaller, they're not at the levels we were seeing probably in the second pandemic, but obviously what else comes with the outbreaks we're having to deal with in terms of the mandatory vaccinations and supporting public health and other initiatives around that. But the outbreaks are remaining static, and we are seeing a positive impact with the vaccination in that those staff that are impacted from the COVID-19 and the resident numbers are lower. So we aren't seeing as many people being admitted to hospital. There are still some instances of people being admitted, but the numbers are a lot lower. We do see the odd larger outbreaks, but again, when I say larger, they're not at the levels we were seeing previously. So we are seeing some positive impacts. But obviously, with those outbreaks that are happening, they are needing support with the workforce, because obviously the staff that are impacted are off work for a period of time. So that's where we are with our COVID-19 task force, an update on the outbreak. So whilst we are still seeing them, it is more positive than it was. Probably not the right terminology really when I say positive, but positive in terms of the numbers and the impacts. We are supporting with the task force in terms of the mandatory vaccination work programme, which is obviously in the report in terms of what support we're needing to support predominantly our care homes, because obviously it's listed in the report around the legislation coming into force on November the 11th, where all those working in the care home will need to have both vaccinations by that date, and the deadline for staff to have the first vaccination was last Friday. So there are a number of staff that are working in the workforce in Nottinghamshire and nationally that haven't had the vaccination. So we are supporting care homes with their contingency planning around how they're going to manage those staff that can no longer work in their service from November 11th. So it's still a picture that's hopefully, it's emerging as we go up to the November 11th, and we've got a plan in place with those care homes that are impacted. In terms of our other updates, we've got the workforce, because obviously we've talked about workforce a lot at committee, and we generally do work with our providers in terms of what we can do to support recruitment and retention, and also the impact of the mandatory vaccination. So we've got the ICS workforce group that a member of my team is supporting in terms of the work ongoing with our partners to try and see what we can do to support the social care market. So there's a number of priorities that's listed in the report that you can see, and obviously it's around recruitment and retentions and nurses into nursing homes. I think that's covered the highlights I want to give to the report. There's quite a lot in the report again to take on board, so any questions?
There's an awful lot of information in the body of the report. We will cover some more in the exempts. Ben, just conscious Councillor Welsh did answer your question from earlier on.
In part, yes, and
we'll pick up on yours first then. Okay.
Yeah, in part, I apologise if I've missed this at any point. But I did ask the question with regards to, there was a number stated in the previous report about the amount of COVID outbreaks in care homes.
268.
And my question was, where were we now with regards to that? And are we anticipating, with the looming winter crisis, that care homes will be under increasing pressure with the forecast of respiratory illnesses matched with COVID, matched with current problems with supply of flu vaccinations and blood vials? There is potentially a recipe for a huge, not massive, challenge for adult social care as we move forward. A different challenge to COVID, perhaps, but still a huge, huge challenge. And I would just really appreciate just knowing where we are with everything. And then the other question is as well, and I don't know if this is because I'm a new member and I've missed out, if there is an outbreak in a care home within your ward, are you notified? So how would I know whether there was perhaps a situation in one of the care homes in the ward that would that be passed on to me confidentially? I just wondered how that worked as well. If some of that needs to be answered directly to me, I appreciate it, but I would really like some clarity on with regards to how we're going to manage further outbreaks. And in addition to that, are we confident that, in light of the fact that hospitals are already on an enormous amount of pressure, we've seen what Nottingham University Hospitals is saying already, is the situation, are we 100% certain that we're not going to get people coming out of hospital with COVID back into care homes again? Because again, that had an absolutely devastating effect, and it shouldn't be happening. And I think we really need to be confident that that's not happening. And in line with that, there is other infectious, the highly infectious viruses. We need to be sure that people aren't coming out of hospital back into care homes and infecting them with these seasonal viruses that actually are already hitting the older people really bad. Councillor Doddy will know perhaps with his own surgery that it's coming through quite a lot. And as I said, I've always had a text message from the NHS about child respiratory illnesses that are on the rise at the moment and what to check out for. So yeah, it's just about that impending winter crisis. It seems to be coming closer, actually, not necessarily winter, more kind of now and autumning. That makes sense. I'm sorry if that wasn't entirely coherent, Councillor Boyle, but I just did my best towards the end of this meeting. I got there.
Okay. Councillor Carr, is your question similar or?
Actually, just to mention, I actually read this report on the same day that there was a news, well, after I read it, there was a news report about how the difficulty that care homes are having recruiting people, and one of the biggest issues is the pay. People can get more money by being behind a bar than they can by looking after old people, and that is a huge issue. Really, yes, the vaccination thing hasn't helped, but this is one area I actually agree with the government on. If you're not prepared to be vaccinated in a care environment, then you know, that's your choice, isn't it? But the other thing, of course, is care homes lost a lot of staff on the 30th of June when a lot of people left and went home to Europe, and that is an ongoing problem, and it's one of those areas really where I think that the government should be looking at actually, you know, special visas for people to work in care homes, because it would have appeared that a lot of our EU neighbours were quite prepared to work in care homes for the money, and whilst we have still got a lot of British people work there, they're not attracted to it because the money isn't good. And it's not with something as a county council we can address, but I certainly think some of the things that were announced last week may go to help with regards to how much we actually pay for people to go into care homes, which will mean that they will be able to afford to pay their staff more. But it's only really scraping the surface at the moment, and it's something I'm afraid I fear is going to get worse before it gets better.
Thank you, Steve. I'm going to hand over to Sue to pick up the hospital discharge, and then we'll go back to Cash and Gemma to respond on the other points, and then I've got two more questions from over there.
So just on the hospital discharge, people do have a test before they go into a care home. Obviously, there's never a 100% guarantee for any transmission of COVID, but all the national guidance is followed when somebody's been discharged, whether it's back to a home they've already lived in or whether it's in a new home. And we're working with our staff and health staff, even though it's very, very pressured, to make sure that that's all in place. So I just wanted to pick that up on the hospital discharge bit, and then I'll hand over to, I don't know, is it Cash or Gemma on some of the broader market issues?
Thank you, Sue. So Gemma will also add to some of these key points, but I just want to, in terms of the workforce pressures, I think we're planning to just do a short presentation on workforce challenges and also the challenges around mandatory vaccination. So we'll do that shortly. So we'll pick up on those points then. In terms of absolutely the points you've raised around the pressures, potential pressures on care homes during winter, and we've got to learn obviously lessons from wave 1 and wave 2 and ensure that we avoid a situation, a crisis taking hold within care homes. I think I just want to highlight that what we've in partnership with health, we've established a care sector partnership group, and that governance structure allows health partners across the system and adult social care to really have those strategic but also operational discussions around all care markets, including care homes, and that's a forum where we're having those conversations and putting mitigations in place. I want to highlight some of the mitigations that we have is that the direction travel very much is around supporting people in the community and how we can support people. So we're looking at increasing capacity within our home care provision, and also we've increased resources within our reablement offer as well. So more and more people can be supported in the community. I also think in terms of our mitigation is that we have established the care home support hub, again, where providers do struggle with workforce or staffing measures. We can enact that, and that was really successful during the pandemic. So we have that in place as well. The quality market management team, and Gemma can touch upon this as well, is that have an oversight of all of the providers. They're constantly in discussion and are intervening early early and with providers if they have got workforce challenges or and in particular if they're impacted greatly around COVID infections and outbreaks. Final thing I would also add is that there are national grants that have been available for care homes and other care providers around additional costs and so on around PPE and infection control. So those are still available, and the care providers can actually still access those through the county council. We have a process to administer those as well. So I just wanted to highlight those are the mitigation arrangements we have in place. And Gemma, if you want to add anything else.
Thanks, Cash. Yeah, it's just to say the guidance that Sue touched upon is robust in terms of the support for care homes now, and very much that obviously if somebody does test positive for COVID, they can't be readmitted to the care home for the period of isolation. So over the period of the last 18 months, that guidance has really supported care homes. Again, it's not 100% because, as Sue says, you never know, obviously. They'll take the test and it's negative, but obviously, again, it's not 100%. So a lot of the guidance has been inputted for us and for care homes to follow and to support. So that's really helped. And in terms of outbreaks, we are working with under 30 at the minute. And so it's nowhere near the levels that we're working with in previous months. So to assure you of that. And again, around the positive, the numbers are a lot less in terms of for each service. In terms of the winter planning and obviously going forward, we're obviously working with colleagues, as I said, public health and the CCGs in terms of making and supporting our services to be as ready as they can. And also there's been investment in infection control teams that obviously sit within the CCGs who support our care homes in sort of managing outbreaks. Obviously it's not just COVID outbreaks, we've got flu outbreaks, we've got the DMV outbreaks. So there is such a lot happening and a lot of support out there to care homes, which will hopefully, there are going to be outbreaks that happen, and it's about us supporting them to manage those. In terms of COVID outbreaks and any other outbreaks information, it doesn't get shared wider though, so I'll have a conversation with you outside of this meeting in terms of what that looks like and what we can and can't do in terms of that information. I think I've covered everything in your questions with Cash's and Sue's. Is that okay?
Thank you.
Thank you. Oh,
Louise wants to come in.
Hi, thanks. Yeah, I was just going to add to some of the points that Gemma raised around outbreaks. So across all of our settings and for any infectious disease, and apologies if you've heard this already, but an outbreak is defined as 2 or more cases. So that range of outbreaks can vary from 2 staff members who have no symptoms to lots more residents. But we manage all of our outbreaks in all of our settings through our outbreak control cell, which is part of the LRF response. So just to assure you, we're looking at those across every setting, across the whole of Nottinghamshire on a daily basis, and we'll escalate up those that need kind of further support, working really closely with Gemma's team, but also the IPC service, so the Infection Prevention Control Service that we have is jointly commissioned by Public Health and the CCG, and we have a kind of core pre-COVID contract that would work around things like flu, DMV, but we also have a specific COVID service. So we've put extra money into that service, recognising that the increased demand, particularly in care homes at the moment, or that we've experienced throughout COVID, and that will be continuing. And obviously those infection prevention control measures that work for COVID also work for lots of other things. So really important to be able to keep going back and educating the staff around those measures and make sure we're following up. The core IPC contract involves things like looking at audits and supporting the staff as well. So lots of support, and obviously would encourage everyone to try and help their those residents, those that are in care homes, to take up the vaccine offer, because that's one of the things we can do, and particularly with the booster, that would be really helpful. So thank you.
Thank you, Louise, for that, and to Gemma and Cash and Sue. I've got 3 more questions, and then I'm just conscious of time. We need to get onto the exam, so I won't take any more after these 3. Okay, so I've got Councillor Lee.
Chairman, thank you very much. Brexit is always used as a stick to hit us with. It's an interesting one that we've seen the HGV crisis across Europe. France haven't left. I believe they're still a part of the EU. Australia was never a part of the EU, and they've got a HGV crisis. But what we have seen is where you're willing to pay people more money, people will come to the service. What I think we need to do as a local authority is to sell ourselves to the young people, to the people looking at work, to say this is a great service to work in. This is a great area to advance and to advance your career. And you should be working for us. And hopefully in the future, not too far in the future, we will be looking at this at the County Council to why people should be working for us.
Thank you, Councillor Lee. And it is something we're looking at, working with the schools, colleges to give it and to provide apprenticeships. I
thought we were talking about care homes, not HGV drivers, but there you go.
Councillor Fielding.
Thank you, Chair. For someone who has been visiting somebody within a care home for almost 7 years now, I can tell you that the people that work there are extremely highly skilled and certainly deserve to be paid more and to be credited more for the excellent job that they do. And some of it is far from easy, and I would say my mother has now got advanced Alzheimer's and no mobility. And the care that she has received in the care home that she's in has been absolutely excellent. And I can't fault it. The support that this county has given to my mother's care home has been through the pandemic excellent. The way that care home has responded and kept me informed as her daughter has been excellent. It has been extremely difficult, I think, for families not being able to see their loved ones as much as they would have wanted to. And yes, my mother's care home has at times been shut down because they've had cases of staff that tested positive, even though they were showing no symptoms. But they've come through it with the majority of residents not catching anything, and of which I would wish to say that we have an awful lot of care homes that have done an outstanding job. I look at 18 and it says we've got 2 inadequate and 21 that require improvement. I mean, that saddens me, to be quite truthful, because I think there's not a person in here that doesn't want excellent care for every resident that's in a care home. And I'm absolutely positive that this authority is supporting those homes to get to a higher standard, because that's what we want. Thank you.
Thank you. I think going back to what Councillor Lee and Councillor Carr, it's recruiting into those care homes that is the difficulty. It's quite well documented. It's countrywide that certain organisations are targeting the staff in care homes to offer them enhanced wages and what have you, and it's how we as an authority do that. They've been through an extremely tough 18 months, probably the hardest 18 months that social care's seen, and if they were offered an easy way out and money is our incentive, then it's something that we definitely as an authority and as a country need to look at. Thank you. I've got one more. I've got Councillor Henshaw.
Yes, Chair. I mean, looking at the report, I agree with a lot of it, and the priorities outlined in the report. I mean, we could spend a full day debating each of those individual priorities as we see it, because it's the nettle we have to grasp is that support work, care work is not well paid. It never has been well paid. And until we grasp that nettle and do what we can as an authority in relation to improving the wages and conditions of people that actually work in care, I think this will be a continued crisis that will be bouncing backwards and forwards for years. It's quite right when you've mentioned about people trying to poach or recruit care workers. If you're a care worker on the less than the living wage or the national living wage, and somebody from Aldi or another supermarket comes to you and offers you £10.50 an hour with a contract, better terms and conditions, it's a no-brainer, because in a care home you have the additional responsibility, you have to do care plans, support plans, risk assessments, you have to give medication very often. Responsibilities, you've got management coming in, looking at things in the way you work in, CQC inspectors, times that you work, unsociable hours, Christmas, Easter, you name it. The care profession, as I still call it, because it is a profession, and we need to grasp the nettle. And if there's anything this committee can do to try and improve the pay of support or care staff, I think it's something that we should look at and do. I'm looking forward to Cash's future report to committee in relation to employment conditions. I mean, years ago when the coalition government actually, because training is a very important thing, and care staff are highly trained. They don't particularly have academic qualifications, many do, but the coalition government withdrew the need for care providers to train their staff up to an MVQ standard, MVQ3 or MVQ4, MVQ5 in management. They said, oh, you no longer need to do that. Terms and conditions, training, very, very important, something that we should be looking at. And if we can do it. So that relates to one of the priorities about getting care staff and sort that out. It's a very interesting report, and I don't want to enter into the Brexit report because we have a debate. We've had problems in care before, but I can tell you now, I know care homes that have had a difficulty because of the things that happened after Brexit, and it is a reality. And even when you talk about staff that are on relief staff, when you go to an agency, very often they don't come from within the EU, but they're not coming over here because they've got to have a job that's £23,000 a year. Anyway, we welcome the report and we look forward to the future report from Cash and the others. Thanks, Chair.
To bring a report back to you.
Yeah.
Okay. We've had a good debate on that. Can we move to the vote, please? All those in favour, show of hands. Thank you. Okay, that's unanimous. Thank you. Right, to the work programme. The recommendation of the report to set out on page 120 of the agenda pack is that the committee considers whether any amendments are required to the work programme. I formally move the recommendation.
I'll second, Chairman.
Thank you. Have we got any points raised from today's meeting to go on to? Okay, that's the work programme. All those in favour, show of hands. Right, now we move to exclusion of the public. We move to the part of the agenda that proposes we meet in closed session to consider the exempt information in relation to agenda item 14. I therefore invite the committee to resolve that the public be excluded for the remainder of the meeting on the grounds that the discussions are likely to involve the disclosure of exempt information as described in Schedule 12A of the Local Government Act 1972, and the public interest in maintaining the exemption outweighs the public interest in disclosing the information. Have a seconder?
I'll second that, Chairman.
Thank you. Can I take a vote? Show of hands. For the exclusion of the public, thank you. We'll just wait while the live streaming.